Thank you. It's so amazing to hear from so many amazing people and to have them as partners. This has been a great experience for me, and I really appreciate the work and all of the passion that is brought to this work. The community engagement piece is so important because that is the connector to what people have identified as issues, and the way that the response has been is to soar into action. And that is what builds trust, and that is what allows these bridges to be built and these solutions to actually be developed and implemented. We have a study advisory group that supports the Embrace work, comprised of patients and providers and community members who all have signed on. We've had 6 meetings since October of 2019, with a minimum of 22 people attending each meeting. We've gotten great support, great ideas in terms of continuing to engage and expanding our engagement, so that we are continuously building a support group and continuously building information and ways to make sure that our recruitment and our retention stays as high as it has been. Our Blue Ribbon Equity Panel is another source of community engagement and connection. And I sit on that panel and update them regularly so that this information is shared and community members are aware of what is happening. And it also is, again, a way of offering a way to act on the solutions, but also to continue to recruit and retain. Our Best Baby Zone was started in 2019. It is centralized in West Fresno with the 4 census tracts that have the highest infant mortality rate. And the advisory group is comprised of people with lived experience who really are working on the ground to create these solutions that make sense to them. And so you always start where the impact is felt the most and where the improvement will be appreciated the most. And then finally, we have a clinical partner group that continues to meet and to provide support and also updates on their actions and their work. In addition to the community engagement with this group, we've just been brainstorming. Black Infant Health has been a wonderful partner. As you heard, many of the volunteers were recruited directly from them, and the leader of Black Infant Health is now a member of the SAG committee. In addition, we've reached out to African American clergy, our task force. We have engagement with our COVID Equity Project. We presented at youth. We presented at Sunnyside High School, which is a doctor's academy for young people actually interested in this issue, who actually did pre-reading in order to be prepared for a presentation. We've reached out to organized political groups, Black Women Organized for Political Action, Alpha Kappa Alpha Sorority Incorporated, which is the first Black sorority, Fresno County Office of Education. It has been an opportunity to really talk about this issue, and it's really been able to galvanize community members around one issue that has so many multiple factors engaged. And so for people who are concerned about infant mortality, they also get to hear about air pollution. They also get to hear about zoning, which is not very sexy, but absolutely has a lot to do with the way that communities are developed, the way that they are structured. And so often the way that we see health outcomes has to do with the way that we either invest or don't invest in communities. So next slide, please. So we are going to continue the partnership with the community because we know that is at the core of this work. They will help with making sure that there's study implementation that is true to the goals of improving birth equity. They help develop study materials and make sure that they are culturally in alignment, and that we would be able to achieve the recruitment milestones and retention rates, because it's a big goal to recruit 1,300 women. And we have identified that a good portion of those will be African American women, so that we actually have information and data that will help improve birth outcomes, and that is the information we take back to the community. And so Fresno is a place with great potential, although it has a lot of challenges, but there's opportunity. And there are just amazingly passionate people that are advocates. These community partners, again, that I've been able to work with are amazing. And we are intentional in getting to a place where birth equity is realized for every person, not just in Fresno County, but everywhere. So I am appreciative of the work. I want to just go to the next slide because I think it's the most effective way to remind us of what we're striving for. This is a beautiful photo taken right after birth. This is 3 generations. So as young as this mom, as young as this lady looks with the glasses, she's the grandmother, and she's holding her new granddaughter while her daughter smiles. That is the goal, that they all survive, they're all healthy, and that the next generations benefit from the work that we're doing. So I thank you again and appreciate the time. And thank you to all the partners. Really amazing. Thank you.
Well, thank you so very, very much for sharing that. That was wonderful.